Imagine this. Your baby actually starts moving as early as 7 weeks of pregnancy. When on ultrasound, it looks like just a tiny dot, and you cannot feel a thing yet. Then one day, you suddenly notice gentle flutters, bubbles, or tiny taps in your lower belly, and wonder, is this gas? Or is my baby kicking? In today's video, using medical research and real fetal development science, we will explore exactly when, why, and how your baby starts moving and kicking, and what these movements say about your baby's health. Stay with this video till the end, because there will also be important tips on what's normal, what's not, and when you should call your doctor. From a scientific point of view, fetal movements begin much earlier than most people think. Research on fetal biomechanics shows that movements can start around 7 weeks of gestation, when the nervous system and spinal cord begin to send spontaneous signals to the developing muscles. At this stage, the fetus is still very small, and these movements are not strong enough for the mother to feel, but they are clearly visible on high-resolution ultrasound as twitches and whole-body motions. By around 8 to 10 weeks, the baby's movement pattern becomes more complex, including general whole-body movements, small startles, and stretches, almost like a tiny fish swimming freely in the amniotic fluid. These early movements are mostly involuntary and reflex-like, driven by the developing spinal cord rather than conscious control. For any fetal kick to happen, 3 systems must work together: the brain and spinal cord, the nerves, and the muscles. Around the beginning of the fetal period, near 9 weeks, the first neuromuscular junctions form. These are microscopic contact points where motor nerves connect to muscle fibers and can trigger contraction. Once these junctions appear, motor neurons send impulses to the muscles, and the muscle fibers start to contract rhythmically, producing visible movements. As pregnancy progresses, control slowly shifts from simple spinal reflexes to more organized patterns involving the brainstem and higher centers, so movements become less random and more coordinated. At the same time, repeated movements provide mechanical forces on bones and joints, and research shows these forces are crucial for normal skeletal development and joint shaping inside the womb. The first time a pregnant woman consciously feels her baby move is called quickening. Although the fetus is already moving by around 12 weeks, most women do not feel these movements until somewhere between 16 and 24 weeks of pregnancy. Many first-time mothers tend to notice quickening closer to 18 to 20 weeks, while women who have been pregnant before may recognize it a little earlier, sometimes around 16 weeks. Quickening is often described as butterflies, fluttering, bubbles, or a gentle tapping sensation low in the abdomen, and it can be easily mistaken for gas or intestinal movement at first. As the baby grows and muscles strengthen, these early flutters gradually turn into more obvious kicks, rolls, and stretches that are clearly recognizable as fetal movement. Not every pregnant woman feels movements in exactly the same way, even at the same gestational week. Several medical factors can influence how early and how strongly you notice your baby's kicks. For example, if you have an anterior placenta, meaning the placenta is attached to the front wall of the uterus, it can act like a cushion between the baby and your abdominal wall, so early kicks may feel softer or appear a bit later. Maternal body weight and abdominal muscle tone can also make a difference. In women with more abdominal fat or very strong abdominal muscles, the sensations may be slightly dampened. The baby's position matters too. If your baby is facing your back, many kicks are directed toward your spine and are less noticeable on the front of the belly, while a baby facing outward may produce more obvious forward kicks. Detailed ultrasound observations show that by around 11 to 15 weeks, the fetal movement repertoire becomes surprisingly rich. It can include whole-body movements and general writhing, sudden startles or jerks, isolated limb movements and kicks, stretching and yawning, breathing-like movements, mouth opening, swallowing amniotic fluid, and even thumb or finger sucking. In the second trimester, mothers mostly perceive these as gentle kicks or taps from the legs, rolling sensations when the baby changes position, rhythmic, repetitive jerks that often represent fetal hiccups, and stronger pushes or stretches as the baby presses against the uterine wall. Each baby develops a slightly different pattern, but over time there is a recognizable daily rhythm of activity and rest. By the end of the second trimester and into the third trimester, the nervous system is more mature and the muscles and bones are stronger, so movements become more forceful and organized. At this stage, many women clearly feel strong kicks, jabs, and rolls, and partners may be able to see or feel the movements from outside the abdomen. Imaging and modeling studies show that the space inside the uterus gradually becomes more limited as the fetus grows. The ratio of fetal size to free uterine space roughly doubles between about 18 and 37 weeks. Because of this reduced space, movement style changes in late pregnancy. There may be fewer large sweeping kicks and more rolling, stretching, and pushing motions, even though the forces generated by the fetus can still be quite high. Fetal movements are not just a cute pregnancy milestone. They are an important clinical sign that the fetus is growing in size and strength, and that the nervous and muscular systems are functioning. Obstetric guidelines consider the mother's perception of movement a key part of monitoring fetal well-being, especially in the second half of pregnancy. A noticeable decrease or change in a baby's usual movement pattern can sometimes signal that the fetus is under stress or not getting enough oxygen or nutrients, and this needs medical evaluation. Many healthcare providers teach mothers to be generally aware of their baby's typical pattern, and some use formal kick counting protocols in later pregnancy, where a minimum number of movements is expected within a set time period, often around 10 movements within 2 hours from 28 weeks onward. Exact instructions, however, should always come from your individual obstetrician or midwife. Many mothers ask if there is anything they can safely do to notice movements more clearly. One common clinical tip is to lie down on your left side in a quiet room, focus on your abdomen, and simply pay attention for 30 to 60 minutes. This position often helps blood flow to the uterus and makes it easier to feel and count movements without distractions. Eating a normal meal or a light snack, then resting, can also make movements more noticeable, because changes in your blood sugar and your own relaxation state may make the baby more active or make you more aware of the activity that is already happening. However, it is very important not to try extreme or unsafe methods. If you are worried that your baby is moving less than usual, the recommendation is not to experiment at home, but to contact your healthcare provider or maternity triage for proper monitoring, such as a non-stress test or ultrasound. There are a few red flag situations that should always be treated as urgent. If you are in the third trimester and suddenly feel that your baby is moving much less than usual, or you cannot recall any movements during a period when the baby is normally active, you should contact your maternity unit or doctor the same day, without waiting. A common rule is that if you do not feel about 10 movements within 2 hours when you are resting and focused after 28 weeks, you should seek immediate assessment, but you must always follow the exact protocol recommended by your own provider. Reduced movement does not always mean something is wrong, but it can sometimes be a sign of fetal growth restriction, placenta problems, or reduced oxygen supply, which is why professionals take it seriously. Hospitals have tools to check the baby's health and decide if further action is needed. Although quickening often falls between 16 and 22 weeks, there is a wide normal range, and every pregnancy is a little different. Factors like first pregnancy, placenta position, maternal body type, and the baby's preferred position can all influence exactly when and how strongly movements are felt. Over time, most mothers learn their baby's own rhythm, more active at night, after meals, or when the mother lies quietly, and this awareness not only helps in monitoring health, but also creates a deep emotional bond. Now that you know how early fetal movements begin, how the brain and muscle